Today we would like to talk to Dr. Erik Briers about his experience with erectile dysfunction. Dr. Erik Briers, your condition is the result of a treatment for prostate cancer. What were your initial complaints?
In prostate cancer, one of the fears of men to undergo any procedure are the two big I's: incontinence, which is not what we are talking about now, and impotence. Every patient who will have a procedure for prostate cancer knows that his potency can be influenced by what's going to happen, whether it will be irradiation or a radical prostatectomy. In my case, it was radical prostatectomy, so I knew before the procedure started that there was a risk that I would be partial or totally impotent after the procedure. So,
which treatment did you receive for your prostate cancer?
In my case, my prostate was completely removed because the objective was to cure my prostate cancer, and at age 50 you cannot wait for it to evolve slowly.
So how are you doing now?
Well, due to this operation, this prostatectomy, I am completely impotent. That means that there is no erection without, let's say, pharmaceutical aids. And this does not mean pills, because pills wouldn't help me. To use a pill, you would need at least a partial erection, which will be afterwards reinforced using the pills. In my case, they would need an injection into the penis to get an erection.
So probably you did see your doctor and talk about this complaints and
Yes.
the consequences?
I went to see an andrologist who, in this case, the diagnosis was rather simple for the andrologist, because he had a report from the surgeon and he knew what happened. So it was very obvious that because there were no more nerve bundles, that there could not be a normal erection or use of any pills. The only thing that he then did after seeing that the erection was nil, that there was no at all, there was a test done to see if these injections would be effective. But they are effective in almost all men, so that's not a question of does it work or not, but to see for this individual patient if it works, and it did work. If this is established, then they still have to find the right dose, because patients all vary. And if some patients, they have enough of 5 micrograms, but others, they might need much more than that. That has to be established. It has to be done by increasing the amount of molecules that they inject into the penis, and to see if the erection has the right quality.
Okay. Do you know how or why the decision was for the injection, not for other possibilities of treatment?
Yes, because if you don't have any erection at all, spontaneously, then you cannot be helped with the pills. They won't help, they can't, because they only reinforce what's already there. Since there's nothing there, they have to use other means, and these are mainly, if possible, these injections.
Okay. How do you cope with the disease, and what are the facts for your personal sexuality?
The consequences are severe. And it's not just because you're 50, because I think that a man of 60 would feel the same. You do lose something in your life, but there is a difference. If this is the consequence of taking care of a cancer that might kill you, that's different from the fact that you say, I'm getting this old and my erection is no longer good. I gained something in my life and I lost something on the way to save it. So,
are you on any medication for your condition right now?
No, I'm not on any medication for my prostate cancer. I'm not on medication for my erectile dysfunction, but since I have no partner for the moment, I don't need that. I know that if I would have a partner, I would need this medication, which is not so complicated to get. You go back to your andrologist and he will help you, period.
Okay.
That's it.
Very optimistic. So how do you see the future?
I see a good future. I've still got my life. And if one day I would need an erection, well, I'll go and see my andrologist and we will work it out.
Okay. Mr. Briers, thank you. We appreciate you taking the time to talk to us today. Thank you.